a child presents at your clinic and his mother tells you that he has an inability to have regular and easy bowel movements. Well, the patient is having constipation for sure. The most common cause of constipation in children is concern from caregivers that they should have a bowel movement every day, even though it is normal for children to pass stool as infrequently as once or twice a week. Well, anxiety from adults about toilet training can also be transmitted to children, which can lead to constipation. In this situation, most children develop normal bowel habits within 2 years. While we have already discussed the constipation in adults in our previous video of this series, but the case of constipation in children is a bit different, as they have different causes and different dietary patterns, so you'll have a quite different approach towards children. Now, there are 3 important questions that you need to ask about the child before making a diagnosis. Firstly, you need to ask the patient or his caretaker about vomiting, excessive urination, crying during bowel movement, change in appetite, abdominal swelling, blood in stool, soiling of underclothes, and behavioral problems. Secondly, you should know how many bowel movements the child has each week, how many the child is expected to have, and what kind of diet the child follows, including what kind of formula, if any, is used, how it is diluted, and how much the child eats. Now, one more important question you need to ask is about his medication history, if the child is taking any medications. Well, this is because the constipation might be the result of adverse drug reaction to any of these drugs. Now that you are well aware of the symptoms of your patient, your main role starts here, because you have to examine the patient. Well, this physical examination includes weight, pushing on the abdomen, rectal exam, and thorough skin exam. Now, what can cause constipation and what is typical for each cause? Well, there are 4 different causes of constipation that you should be clear about: rectal fissures, abnormal feeding in the case of infants, bowel obstruction, and encopresis. I'll be explaining these terms in a while. Now, if the patient shows symptoms like a pain on bowel movement and blood in stool, then this might give you an indication that patient has rectal fissures. Well, rectal fissures are the tears in the tissue lining the rectum. But if your patient is infant and has typical symptoms like weight loss and dehydration, then it might be an indication to abnormal feeding, like infant formula might be overly concentrated or the infant does not get enough fluids. But what if your patient is having abdominal swelling, decreased volume of stool, severe constipation, vomiting, and weight loss? Then this constipation might be caused by bowel obstruction, which is in fact block in the passage of stool through the intestine. And lastly, if the constipation is accompanied by behavioral problems and soiled underclothes, then encopresis might be a reason to this. Well, encopresis is the inability to control stools and usually occurs after the age of 4 years. It is also sometimes called fecal incontinence or soiling, and is in fact the repeated passing of stool, usually involuntarily, into clothing. Typically, it happens when impacted stool collects in the colon and rectum. The colon becomes too full and liquid stool leaks around the retained stool, staining underwear. So now, if you are clear about your findings, you can manage your patient accordingly or do further investigations if required. That was all about the differential diagnosis of constipation. Stay tuned to sqadia.com for more such precise and knowledge-stuffed videos.